Thank you, Jenny. And for those of us in Washington who think a lot about federal policy, I think it's very enlightening and gratifying to hear about the interplay between what we are talking about at the federal level in terms of policy change, what we are seeing in the national media around the debate over sugar-sweetened beverages and the like, and the role of local governments and local nonprofits and activists who are engaging on these same issues. Each part of that equation is supporting progress in the other part. I don't know if you have progress in an equation, but anyway, there's an interplay there which I think is very important, and one of the things that I think we wanted to draw out was how those spheres of influence can help support each other. So let me shift over to Allison Gertel-Rosenberg from Nemours. She is the Director of National Prevention and Practice for the Nemours National Office of Policy and Prevention. So she is responsible for leading the office's efforts to spread and scale promising practices and strategic prevention initiatives designed to curb childhood obesity on a national scale. Her work involves a lot of the intersection of population health and clinical care that we've been talking about today. Please welcome Ms. Gertel-Rosenberg.
Hello. I often think when I present this late in the day that I wish I had my computer open while the rest of everyone was presenting so that I could have updated everything that I would have loved to say based on everything that the smart people before me said. But since I didn't have that opportunity, I will ad-lib as I go. So thank you very much to the IOM for inviting Nemours to participate today. We are excited to share the work that we've been working on with a number of partners in this room and to talk a bit about what we're learning as we move this work forward. And so I get to skip a lot of the data because Diane did such a great job of sharing so much of the data about what's happening in early care and education settings across the country. But I do have the opportunity to talk about why a health system is really interested in early care and education as a place to do this type of work. As a healthcare system, as a pediatric system with hospitals and clinical services, we've obviously had a vested interest in the health of kids for a long time at Nemours. And about 9 years ago, really had this opportunity to think about the role that we might play in prevention and where we could actually have a really important role, fill a space, fill in some white space, if you will. And so have had the opportunity to really think about early childhood and early care and education specifically as a place to do this prevention work. And one of those slides that I wish I had added in before my next slide was that slide that shows 360 degrees of child health promotion, because I think based on the conversations that we've been having today, thinking about everything in a silo, whether that's sector or age or place or wherever we want to look at it, it really is this idea, or messaging from the last section, it really is this idea that we need this continuity across the lifespan, across the places where kids spend their time, where they're getting their messages from, that their moms and their doctors and their dads and their early care and education providers aren't confused and aren't sending different messages. And so as we focus on early childhood today, I really am struck by the reminder that it's not this one thing or this one place that's going to do it. It really is those multitude of actions and how we think about how we work with our partners across those sectors and across those spheres to really ensure that what we start in early childhood continues across that lifespan for the child. And so we thought about our strategy in a number of ways at Nemours, really thinking about geographic populations for a health system. That's a big move when we stop thinking about our patient panels and we start thinking about larger geographic areas. Thinking about those multi-sector partnerships where kids live, learn, play, pray also gets added in many situations. To Jenny's point, thinking about pursuing policy and practice changes at the same time. Definitely not an either-or situation. I think the real art comes from figuring out when we're leading with practice change and when we're leading with policy change, and how we can use each of those different components to create some sustainable actions and opportunities within the places where we're working. We've thought a lot about social marketing in the past, how we fill in some of those holes between policy and practice. Thinking about technology, and as I get into lessons learned earlier, sometimes I think we get a little bit ahead of ourselves on technology, and we need to step back and revisit and think about how technology affects the people who we are working with and who we are attempting to change the behavior with. And then thinking about how we can serve as integrators. I think at Nemours, we're really lucky, and a lot of us in this room are really lucky to be able to think across these sectors and to think across these places and the roles that we can play in breaking down those silos, making the connections that need to happen, and thinking through what synergistic effects can occur when we aren't focused on one place or one time really is an optimal role for us to play. So this is a very busy chart, and I put it up there so that I didn't go through each of our individual programs that we've been doing at Nemours around early care and education, but really to think about how, number one, this is a time investment. This is not something that we have gone into lightly. We've thought a lot about how we can leverage our environments where, quite frankly, Nemours had a physical presence. So if you look all the way in 2006, those child care pilots, those provider workshops were happening in Delaware. Were happening where Nemours had a physical location. It was a great place to do this work. 800,000 people total, but a great representation and cross-sectoral knowledge around different populations, rural, urban, different socioeconomic statuses. We have military bases, we have farms. It's really a great way to look and see how things might work. And it gave us a lot of lessons about that policy and practice balance and that idea of thinking through what opportunities, what levers exist that we could move as we think about changing behaviors of children in early care and education settings. We had the opportunity to work with, and I know that I'm going to name a lot of people that I'm looking out at right now in this room, but we had a great opportunity to work with Sesame Workshop on thinking through how to use the toolkit and their characters to influence children in early care and education settings and what that meant if we were doing interventions. A lot of what we've thought about is how do we take turnkey solutions. We all have talked about the provider, the early care and education provider today, or even the physician provider. That time is probably their most limited resource. And the ability to make sure that the things that we're asking folks to do have some sort of tool associated with them to make that easier, to make it the easy choice, if you will, that they're not struggling to figure out, how do I talk about this? What do I have to do next? How can I make this policy work in my center? How can I make this practice work in my center? We want to make sure that those tools are available. And so we had the opportunity with the Sesame Workshop toolkit to do that, and then over the years have developed other toolkits to fill that role. Delaware is also where we had the first opportunity to work on learning collaboratives, and we heard earlier today about that power of peer learning and that ability for folks to sit down with like-minded people that face like-minded situations and to hear about how they overcame those challenges, how they accelerated success, et cetera. And so in Delaware, we started learning collaboratives and thought about how we could work with providers in groups to do peer learning, to think about those changes. And we have had the great opportunity with support for the Centers for Disease Control and Prevention now to spread those to 10 states as we think about where to go and what to do. And other funders who have thought about, how can I leverage that investment? How can we leverage that investment and make more opportunities? And I think this is a great example of initiatives that may start small and may look different as we spread and scale them. I think if you look at what we implemented in Delaware, it probably looks very different than what we have wound up with implementing in, say, California or in New Jersey. But it has the flavor, it has the background, it has that evidence behind it that was showing that when we look at the evaluations for those CDC-funded early care and education learning collaboratives, that we are seeing differences in pre and post tests of the providers, that they are implementing more best practices around those healthy eating, physical activity, screen time, and breastfeeding support areas. And so we think about how then to scale that, to think about how to support that, and then the idea of those systems. We talked earlier today about the feathers or the levers that have been identified as opportunities. The Undersecretary talked about so many initiatives that exist that can help to influence kids in the environments in which they live. And so in those states where we work on implementing practice changes, we're also thinking about how do we take those systems that exist, not creating new systems, not trying to overwhelm the providers with something else, but rather how can we leverage those, how can we work across our field and across other fields in order to take those great opportunities and to move them forward. There's a whole range of things that we have moved on with this, and I think the major issue and the major similarity across all of them is really that recognition that policy and practice change together are going to be stronger than one alone, and figuring out the context of the place where you are implementing. Early care and education is such an interesting component when we talk about whether we're using federal level levers or whether we're using state levers. There's a lot at both areas, and thinking about the context of what we can do and what we can move, and then how to benefit from those, I think, is the opportunity that we have in early care and education. And I always think it's fun to talk about what it actually means to the providers. And so as we think about the examples of that ECELC, or that Early Care and Education Learning Collaborative, to me what's most moving is we may move the pre and post dial. We may see more best practices put into place. And the cool part about that is it's not just the child who's in care right now, it's then the child who comes in next year, and the children who come in years after that, that really thinking through how we're changing those environments in an ongoing way. But I think what's really interesting is when we hear the feedback from the folks who are doing this, who may have said in the past that I can't change the food, the kids won't eat the food. That when we actually put these things into place, that people are being inspired to change their goals, that children will eat healthy food, that family-style dining can work, and there are great opportunities to do it and to leverage that success. And the cool part is when other providers hear another provider say, it was really hard to figure out the bowls to pass for family-style dining, but once we did, the kids really benefited from it, and here's what we did, and here's what you can do. We talked about staff earlier and the providers themselves, and I thought this was a great example of how the staff are feeling empowered to become role models, that it's been a great experience, that it's been an opportunity to implement, that for a lot of folks it may be the first time that they're gardening, or it may be the first time that they're talking about getting down on the floor, going outside to play with the kids in their care, but when they're doing it, they're learning what it means, how to do it, and taking that to heart and figuring out then what the next point of implementation is. So I wanted to talk about lessons learned, and a lot of the lessons learned that we've talked about today have been very macro, and I think those are all really important, and I have some of those too. I think what have been the most striking for me in lessons learned have been some of the micro lessons learned, what I've learned about working with providers, how it's changed how I do my work, and think about what it means when I go into the field and work with others. We are working with a lot of state organizations, and there are varying levels of bandwidth. And we need to think about how we're supporting state organizations, whether those are CBOs or government agencies, to have the bandwidth to manage and implement large projects. It's a high expectation to bring something into a community and be like, implement this, without having some support there. State organizations don't think naturally about breaking those barriers down. Much like everybody else in the world, they're busy trying to do their job and get their job done. And so the more that we can do to interweave and to make those connections happen and figure out where the push buttons are, I think the better we are. We're asking center staff with our learning collaborative model to do something new. These are folks who teach young children who are now asking to teach other adults. And so we need to think about how we coach and train on that and how we have peer leaders developed within the field. Spread and scale has been a big topic for today, and I think that this idea of fidelity versus customization to local context is really important. I think as we are thinking through what some of the gaps may be, figuring out what the key components are that need to be replicated is really important. And then figuring out where different concepts can be tweaked, if you will, to fit the context of the local communities or states where things are being implemented is also an important concept for us to be thinking about. As we think about trainers and we think about going across sectors, I think taking into account that we may not see the perfect, if you will, trainer come about. If we want to talk about health and we want to talk about early care and education, we may see different strengths coming up. We've started pairing trainers together, trainers that have strengths in early care and education with trainers that have strengths in health, in order to try and bridge that gap and to create more synergy. Back to technology, I think it's a really interesting story that when we first started working with the CDC on the Early Care and Education Learning Collaboratives, I had this really great idea that we should give iPads to every provider that we were going to work with, and that they could enter the data every day with the iPads, and we would have this wonderful moment of being able to collect data instantaneously and make changes as it was occurring, and I was very quickly shut down. For a lot of reasons. But I will tell you this, the majority of our data comes in pen and paper. And that's what folks are comfortable with in the field right now. And we should be pushing on technology, but we should also be recognizing that technology may be a barrier, and we don't want to turn people off to participation by putting high barriers into place. We have all found early care and education as a place to do prevention. And sometimes we overwhelm providers when we all show up saying, hey, we think you are the key to reaching children. We know how much time they spend with you, and we have this great project, this great quality improvement initiative, this great policy that you should do. We need to think about how we are also thinking as a field about prioritizing and coming together with a coordinated agenda. And then thinking through what the constraints are for time, thinking through the constraints of parents. If they're packing lunches, that's a very different thing than if food is being provided in a center. We need to think about how we can coordinate this with family providers who may not be center-based, who don't have large staff, who can't pull a provider out to come to learning sessions when they are the provider in a place of care. So these are obstacles that we are facing. I think that we are thinking about how we can support these changes, how we can support these providers, and thinking about what lessons we have learned that can be taken forward and put into place in other initiatives that are going on around the country. And I have my disclaimer, because I did talk about our CDC work. And if there are any questions, I look forward to the conversation. Thank you.